The MaxZero and MaxPlus needle-free connectors and extension sets are part of a trusted line of IV therapy products from BD. The BD MaxPlus needle-free connector was shown to reduce the risks of CLABSI by 63% compared to other needle-free connectors in a 2014 peer-reviewed meta-analysis published in the American Journal of Infection Control. While a needle-free connector is a relatively small medical device, it can have a big impact on reducing bacterial contamination. The differentiated design of the Max needle-free connector technology has been helping facilities reduce central line-associated bloodstream infections and occlusions for over 10 years. These design features include a visible fluid path so that clinicians can assess the efficacy of their flush technique, a solid and sealed access surface that can be efficiently disinfected, and a one-piece fluid path for effective flushing. The BD Max needle-free connector technology has been shown to reduce the incidence of occlusions, which can help to lower costs associated with catheter restarts and alteplase use when compared to a leading neutral displacement device. This short video highlights the features of the MaxZero and MaxPlus connectors that help with each of these key areas. And you will learn specific instructions on how to use the device correctly to take advantage of all its features. As with all components of an IV system, it is important to begin by properly priming the device. In addition to removing air, effective priming seals the internal surfaces, aids in complete flushing, and helps reduce reflux. To begin, carefully peel back the package, attach a pre-filled syringe, and invert the needle-free connector and prime the device so air can escape upward. Leave the vented end cap in place while priming to help ensure sterility of the distal end. For multi-fuse extension sets, remember to prime all leads of the set and invert to let air escape upward. Before attaching to the catheter, remove the vented cap. Extension sets feature a two-piece spin collar. Pull back the collar. Insert the male lure and give it 1/4 turn. Then tighten the spin collar. Do not over-tighten. Remember to disinfect the needle-free connector before every access per your hospital's protocol and per the instructions for use. Perform active disinfection by a rigorous mechanical scrub using a flat swab pad containing 70% isopropyl alcohol or alcohol-based chlorhexidine suitable for use with medical devices. Let the device dry to complete the disinfection process. Complete drying also allows for an easier disconnection after an infusion is complete. Each needle-free connector on the market has a unique access surface. Some connectors may have holes, slits, gaps, or irregular surfaces that may contribute to incomplete disinfection. The MaxZero and MaxPlus connectors feature a unique and proprietary, completely solid and sealed access surface that can be effectively disinfected in just 3 seconds. Connectors with complex internal designs and multiple moving parts also have interstitial space inside the connector where fluid, contaminants, and bacteria can be trapped and cannot be flushed or disinfected, and that can be transferred to the lure and ultimately to the fluid path. The Max connectors have no interstitial space. The MaxZero and MaxPlus connectors can be disinfected in 3 seconds and maintain a microbial barrier when disinfected per directions for use over a period of 7 days and 200 accesses. With proper disinfection technique, you can be confident that you are making a trusted connection. Always trace your line prior to connecting to a device to avoid a misconnection. Unclamp the catheter or extension set prior to accessing the connector. If the male lure is a two-piece spin collar, pull back the collar. Insert the lure with a straight-in motion and rotate it 1/4 turn clockwise before tightening the spin collar. The MaxZero and MaxPlus connectors are metal-free, power injectable up to 325 psi at 10 milliliters per second, and compatible with harsh infusets and lipids. To detach, disconnect the syringe or tubing slowly and with control. Hold the connector, not the catheter, when disconnecting. Because the access surface is solid and completely sealed, a small bead of fluid will likely remain after the lure is removed. If necessary, simply be prepared to wipe away any remaining fluid. The clamping sequence when disconnecting from the connector is determined by a needle-free connector's displacement type. Positive displacement needle-free connectors such as the MaxPlus and MaxZero needle-free connectors proactively clears the catheter tip via anti-reflux technology. It does not reflux blood into the catheter upon disconnection, regardless of clamping sequence. On the other hand, a negative displacement connector will reflux blood back into the catheter if a specific clamping sequence is not precisely followed. To take advantage of the anti-reflux feature of the MaxZero and MaxPlus connectors, clamping should occur after the tubing is disconnected from the connector. Adequate flushing of the needle-free connector and catheter is important for catheter patency and dwell time. According to INS standards of practice, use a minimum volume equal to twice the internal volume of the catheter system. This includes the catheter plus add-on devices. Larger volumes, such as 5 ml for PIVC and 10 ml for CVADs, may remove more fibrin deposits, drug precipitate, and other debris from the lumen. Factors to consider when choosing the flush volume include the type and size of catheter, age of the patient, and type of infusion therapy being given. Infusion of blood components, blood sampling, parenteral nutrition, contrast media, and other viscous solutions may require larger flush volumes. For viscous fluids such as blood, or when attempting to flush with lower flush volumes, it may be helpful to do a flush, disengage, re-engage flush sequence. Always flush the catheter immediately after infusion or aspiration. Use a pulsatile flushing technique. In vitro studies have shown that 10 short boluses of 1 ml solution using a push-pause technique until it is clear. Consider flushing all lumens of a multi-lumen catheter after obtaining blood samples to reduce the possibility of changing intraluminal pressure, causing blood reflux into the other lumens. Please consider the following reminders as you incorporate the MaxZero and MaxPlus connectors into your IV bundle. 1. Prime upward for complete air removal. 2. Scrub with friction for 3 seconds or per hospital protocol, and let the connector dry before every access. 3. Open clamp on extension tubing. The clamp must be open to flush. Clamp lines after removal of syringe. 4. Use a push-pause pulsatile method when flushing. Remember, the MaxZero and MaxPlus connectors have been tested for a 7-day change-out policy, but follow your own hospital's protocol. Per 2021 INS Standards of Practice, evaluate published outcomes of infection risks associated with each type of needleless connector when making product purchase decisions, focusing on risks and benefits.